Ma'am. Hello, ma'am.
50 participants are there. We will stick on to the time. Let us go ahead.
Yes, ma'am. Thank you, ma'am. ज्ञानानन्दमयं देवं निर्मलस्फटिकाकृतिम् आधारं सर्वविद्यानां हयग्रीवम् उपास्महे. Namaste, Shubhodaya, respected dignitaries, Principal Dr. Anuradhayam, dear colleagues, ladies and gentlemen, and my beloved students. This is Dr. Nethra Subramanya, MC for the day, on behalf of Padma Shri Institute of Management and Sciences. Welcome Dr. Ashwath Narayan, Honorable DCM, Minister of Higher Education, IT and BT, Science and Technology, Skill Development, Entrepreneurship and Livelihood, Government of Karnataka. Shri Nayanappa Sir, Managing Trustee, Padma Shri Group of Institutions, Shri Satish Sir, Chairman, Padma Shri Group of Institutions, Professor Shenoy Sir, Director, Padma Shri Group of Institutions. Our Principal Ma'am, Dr. Anuradhayam, Padma Shri Institute of Management and Sciences. Today's eminent guest speakers, Ms. Sudha Rao, founder of Yoganjali, School of Yoga for the Body and Mind, USA, Dr. Savita Karakol, Dr. Vedamurtachar, yoga teacher out of Living Bangalore, dear teachers and friends, to the Yoga and Stress Management virtual webinar on the occasion of International Yoga Day. Firstly, I would like to wish the gathering a very happy International Yoga Day. International Yoga Day is an annual event that has its in an Indian context but is commemorated every year on 21st June. The idea of International Yoga Day was conceived by our Prime Minister Sri Narendra Modi, who proposed the concept on September 24, 2014, during his at the UN General Assembly. The resolution to adopt June 21st as the International Yoga Day was introduced by India's Ambassador Ashok Kumar Mukherjee. This resolution can be viewed as a triumphant moment for Indian soft power as it received support from 177 nations. This theme for the event is Yoga at Home and Yoga with Family in line with global concerns around the COVID-19 pandemic, emphasizing the importance of maintaining good health but within constraints of social distancing. This can also be seen as a means to encourage people to find creative outlets during a situation. Activities that can be indulged in this yoga day include leveraging social media platforms such as Instagram to spread awareness and connect with people on this issue. More insightfulness about the yoga would be given by our guest speakers today. Now, let's begin the session with the blessings of Almighty.
गच्छध्वं संवदध्वं शं वो मनांसि जानताम् शं वो मनांसि जानताम् देवाभागं यथा पूर्वे देवाभागं यथा पूर्वे सञ्जानाना उपासते सञ्जानाना उपासते सञ्जानाना उपासते सञ्जानाना उपासते सञ्जानाना उपासते सञ्जानाना उपासते.
It's time to listen to the inaugural address by our DCM, Dr. Sir. Dr. C.N. Ashwath Narayan is an Indian politician and the 10th Deputy Chief Minister of Karnataka and the current Minister of Higher Education, Information Technology and Biotechnology and Science and Technology, Skill Development, Entrepreneurship and Livelihood in the Government of Karnataka. He is a member of Karnataka Legislative Assembly representing BJP from Malleshwaram constituency, Bangalore, Karnataka, a multifaceted personality and a firm believer of technology. Dr. Ashwath Narayan is an educationist, healthcare entrepreneur, and philanthropist. He is the president, Samskara Bharati Malleshwaram, vice president, Bharatiya Janata Party, Bangalore, convener, Dr. Cell, BJP Karnataka, syndicate and Senate member, Rajiv Gandhi University of Health Sciences, Bangalore, Senate member, Bangalore University, founder president, Rajiv Gandhi University of Health and Sciences, Chairman, Committee for Drafting Statutes for A and B CNG Cadre of Employees of Rajiv Gandhi University of Sciences 2002-2002. Sir, I welcome you to address the gathering. Over to you now.
Namaskara and a very good morning to all the participants who are participating in the International Yoga Day. Today is a day of our identity, our culture, and the way of life of our society. Yoga means everything to us. Yoga is solution. So we need to practice, promote, and spread yoga across the world. So in this direction, Padma Shri Institute of Life Science is conducting the yoga program. The International Yoga Day has been celebrated. Probably, along with the celebration of the International Yoga Day, the theme should be adapted among all the students and the institution, all the stakeholders, teachers, non-teaching, students, everybody needs to practice yoga. In every day we need to practice. So probably culmination and celebration of Yoga Day is to share and care how yoga has made a difference for our entire earth and society. So in this occasion, the dignitaries, Sudha Rao, the founder of Yoganjali, are present, and Dr. Savita Kadugol, who has taken a lot of interest in the promotion of yoga and been practicing yoga. Today's demonstrator, Vedmurti Achar, who is here to demonstrate us the yoga. I recognize and appreciate his presence, and today is going to demonstrate. So at the same time, our Honorable Managing Trustee Sri T. Kananappa and all other dignitaries, Rajesh Shanai, and many more people were assembled here or on the virtual VC, the participants on the VC, and all other staff members. I appreciate for organizing this event and spread of yoga. So yoga, which started more than 6,000 years back, it is our contribution, India's contribution for the entire world. Under the leadership of our Honorable Prime Minister, International Yoga Day was declared. So none other than the leadership of the Modi, Narendra Modi, who himself practices yoga and he's been promoting yoga and he's been practicing each and every day. So the kind of vibrant leadership what we could see in Narendra Modi ji or in Swami Vivekananda, it is all because of the yoga. Yoga has been practiced by our all Sanatana Dharma, and it has got no religion barrier. Each and every person, whoever has learnt and practiced yoga, they have seen the difference in their lives. So we need to say, promote and inculcate the practice of yoga in everybody. So let us all work in this direction to bring in the peace, prosperity, harmony among all through yoga. Once again, I wish all the best to all the organizers, participants who are participating in the International Yoga Day. And let us all practice, adopt in our lives. Namaskara, Jai Hind, Jai Karnataka.
Thank you very much, sir, for your words.
Thank you, sir. It is indeed a pleasure and honor to us to be you being part of this particular program. As you said, yoga is part of life. This is not just a practice which we do on International Yoga Day and just keep silent later. In these challenging times, it is really very, very helpful personally because I do practice yoga every day and really helps, to tackle the challenging times because this COVID-19 creates a lot of stress and breathing problems because yoga has got answer to all of these things. My dear participants, I don't want to take much of your time because we have good personalities who are really practicing yoga as their lifestyle with us today, and they are going to talk with us and they are going to clarify our doubts. Which whatever doubts you have, you can please ask, raise your hand and put in a question in a chat box, and later those things to be answered. This particular session is being divided into two sessions. One is 6:30 to 7:30, or it may just go little more because we need to take the advantage of people who are from USA staying awake in the almost it might be 10:30, 11 there, and they are there with us and they are going to clear your doubts. You have doctors and you have yoga practitioners from USA, and at 9 o'clock we'll have a break, and after 9 o'clock we'll assemble again for the yoga demonstration by Art of Living personality. Thank you all of you for assembling for this yoga day. Happy yoga day once again. Over to you, Nethra.
Thank you so much, ma'am, for your motivating words. Without taking much time, let's listen to our first speaker of the day, Ms. Sudha Rao, founder of Yoganjali, School of Yoga for the Body and Mind, USA. It's our privilege to have you with us, ma'am, and I request you to address the gathering. To you now.
Thank you very much, Dr. Nethra. Appreciate giving us an opportunity to talk today. And I consider that an honor for all of us, to be able to present. So today, I would like to talk about how yoga and meditation practices can help handle the stressful situation during the COVID pandemic. And what does the evidence-based research say about our ancient practices of yoga and its effect on our body? That would be the topic that I have chosen for today. We all know billions of dollars have been spent on the study of COVID virus, the drugs to treat it, and the vaccines to protect us from contracting the deadly virus. These researches are targeted on the external agent, which in this case is the virus. However, very little money has been spent on researching the host, which is us. How can our immunity system be increased? How can the antiviral capabilities in us be increased through integrative practices like yoga? So very little, money has been spent in these kinds of researches. However, some of the major universities like Massachusetts Institute of Technology, University of California, Chopra Library for Integrative, Studies led by Dr. Deepak Chopra, Harvard University, they all came together and jointly made a study on integrative approaches. They concluded that certain meditation, yoga postures, and pranayama practices can be effective in treating or preventing the COVID-19 infection. Now, what is the reason for the increased COVID-19 morbidity and mortality that we are seeing today? That is, I think, one of the first questions that we need to address. One of the main reasons is our extended hyper-inflammatory response to the virus. I want you all to pay a little more attention to this, this word, extended hyper-inflammatory response to the virus. Our inflammatory response is to attack the pathogen, of course, but instead it is damaging our own tissues, leading to acute respiratory distress syndrome, which in short is called the ARDS. I think all of you are familiar with that. Also, please recognize that the virus itself has much lesser role in this tissue damage. This tissue damage ultimately is, producing extreme critical disease states such as the pulmonary aspiration, septic shock, and potentially it's causing death. Not only COVID-19, but many of the infectious diseases have caused their damage to a large extent through our own inflammatory responses. What is the reason for this extended hyper-inflammatory response that we are all having towards this virus? What is this? COVID-19 introduced psychological stressors, including social isolation. I don't think until this COVID-19, I have never faced this kind of a social isolation or this kind of a stressful time. This is an unprecedented time that we are facing. While it is necessary to have certain level of stress to handle the challenging situation, the stress levels of people experiencing during this pandemic is extreme. We have never, as I mentioned, not only our health is threatened, but our very physical survival along with our economic survival are also threatened. We have to deal with the housing challenges, job loss, possible job losses. Some of the people have lost jobs, inadequate nutrition, lack of exercises due to lockdowns. People have smaller houses, they're not able to do any kind of exercise, social isolation. And then we have to also deal with bereavement due to loss of loved ones, family, friends, colleagues, uncertainty of the future, threatening the very fabric of the society and the normal life itself. This is a lot for all the people to deal with. Probably the most extreme stressor is the prospect of being a patient in an overwhelmed health system, secluded from the loved ones, and having the prospect of death, not surrounded by the loved ones. Probably that's the most scariest thought for many of us. These extreme chronic stressors are fully capable of overwhelming our immunity system. An overwhelmed immunity system cannot effectively handle the virus when we are affected by it. It can overstimulate our inflammatory responses to such a level that it can lead to tissue damage and even death. Now, can yoga and meditation help in these acute situations? What does the research tell us? So, Holzel, in his research on meditation, found encouraging results. with attention regulation. So he noticed attention regulation, which we all have experienced as we practice yoga, by the way. But the research has to be evidence-based, for the scientific world to understand. He noticed body awareness, increased body awareness, emotion regulation. So your, the emotional turmoil that one goes through during such a tough time of happiness and sorrow, that the emotional regulation happened, so people were able to handle it. And the perspective of self, what am I, who am I, and why am I facing this situation? So perspective of the self also he was able to notice in his research. He also found neuroplastic changes. I think some of you all are familiar with that. For those of you who do not know what neuroplasticity is, it is the brain's ability to change and adapt as a result of an experience. So our brain initially was thought to be static, but now we have found out that it is constantly changing in response to the environment. If you're in a positive environment, the neural network will rewire itself and adapt to the positive environment as a result of the homeostatic response in the body. Another researcher called Bower, he showed in his research that 6 weeks of 20-minute daily mindful meditation resulted in a significant downregulation of pro-inflammatory genes and an increase in the anti-inflammatory activity linked to the COVID-19 treatment. So those are really significant findings, I would say, in the research that people have done so far. Another advantage of meditation and yogasana practice is that it can increase the activity of melatonin. Now, melatonin is important because it has health promoting properties. It promotes mood elevation, it stabilizes the emotions and the mental state. Melatonin is also anti-inflammatory, antioxidant, anti-infectious. It has immune-enhancing actions on most of the cells and organs of the body, including the brain, the heart, the visceral organs, bone, muscle, skin. It has significant antiviral properties. Now, in this context, it is, I think, the right time now to remember Patanjali, who lived about 2,500 years ago. And he wrote the Yoga Sutras, which prescribed 8 steps to be in a joyful and healthy state of being, healthy state of mind and body. Yogic philosophy calls it as enlightenment, because you have the knowledge and the wisdom, not the knowledge of the mundane things, but it's a knowledge of what makes me happy, what makes me joyful, and how to sustain that joyful state for forever. So in his 8 steps comes the first 2 steps, yama and niyama. These are the first 2 steps. Yama, I'm not going to go into detail with those steps. Yama represents the ethics we need to follow when we interact with other people, like practicing honesty and truthfulness, the non-violence, etc. And this helps us to maintain harmonious relationship with the people outside. So it's maintaining harmonious relationship with the environment outside of you. Now, the niyama is the code of conduct towards one's own self. So how do I maintain harmony within my own self? Okay, and there are some austerities that has been prescribed, like tapas and practice of contentment, swadhyaya, self-introspection. Or, as I mentioned, we're not going to go over those practices. These are not imposed moral codes, by the way. A lot of people think it's like the 10 commandments. You have to always speak the truth. You need to do this, that, this, that. It's not an imposed moral code. It is our natural expression of behavior. We spontaneously have this in us. It's our natural state to be truthful, natural state to be non-violent, natural state to not take things that belong to others. So those get expressed when you are in a state of being, when you're in a state of higher consciousness. The third one is the asanas, the postures. I think all of you are very familiar with that. We sit, straight and keep the spine erect, and we adopt a lot of postures we, practice. So this is what asana means, is effortlessly sitting with your breath. Okay, effortless sitting with awareness, focused on your breathing practices. That is posture. Now, there are thousands of postures. In postures, you become aware of which part of my body is being stretched, what is happening to my breathing rate, and am I aware of my surrounding, and am I aware of what is happening inside of me. So there is a heightened awareness in the state of when you do the postures. When you combine this posture practice with the deep breathing, you're actually stimulating certain nerves that go directly to different organs in your body. So these nerves are called the visceral nerves, reaching your lungs, your heart, your kidneys, your liver, intestine, spleen, etc. If you have a regular yoga practice with about 30 postures, you will be stimulating every nerve in your body, going to every organ. So if you now say, for example, you have a headache, you have digestive disorder, maybe you have back pain or knee pain or anxiety and depression, and before you go into a yoga class, as you practice, you'll start feeling better, and better and better. That's because the self-regulatory functions automatically begin to fix parts of your body that is aching or is dysfunctional. How does it do it? How does yoga fix these parts? It does it through the toning of the vagus nerve. Now, this is something new that has been discovered, but Patanjali knew it thousands of years ago. So now they're finding out, hey, when you sit with your spine erect, you're toning the vagus nerves. What are these vagus nerves? Where are they located and what do they do? Those are the questions probably you all have in your mind. It is the 10th cranial nerve that starts from the brain stem, and it spreads like your wandering dew. It's like a wandering nerve that goes and connects all the different organs in the middle part of your body. What does it do? It takes messages from the brain to the different parts of the different organs, and it takes the messages from the organs to the brain. So that is the vagus, and it has two: ventral vagus system, and then it's the dorsal vagus system. Now, what happens when you do yoga and meditation, right? As you're going through this pandemic, when you're in a fight or flight or a freeze mode, okay, these are the stressful responses that we have naturally to a challenging situation like the virus that we are going through right now. The whatever situation, challenging situation that we're going through, we have this fight or flight or freeze response. In this response, the sympathetic nervous system gets heightened. It stimulates the sympathetic nervous system, and the dorsal vagus nerves will shut down the visceral organs and sends a distress message to the brain, increasing our inflammatory response. Now, that is the heightened inflammatory response that I talked about in the first, first 10 minutes of this, first 5 minutes of this lecture. So, however, when you connect with people in a very positive manner and do yoga and deep breathing, which is pranayama and meditation, or chanting om, or humming, as in Brahmari breathing, what happens? The ventral vagus nerves get stimulated, your parasympathetic nerves gets stimulated, and your organs in your body sends a message to the brain saying all is well. Now, that is the message we need to keep sending from from our gut. That's where we feel the fear first. So from the gut, if the message always goes to the brain that everything is well, the body and the mind immediately begin to relax, and we go into a homeostatic state of being. This reduces the inflammatory response of the body, and immediately the healing state kicks in. Okay. Now another example that I can give you is we have now some electrical devices that they have been implanting in patients. If you put it in the path of these vagus nerves, when you stimulate it externally, it tones down the sympathetic response of the vagus nerves, and this is used effectively in the treatment of intractable epilepsy. They've also found it not only treats the epilepsy, the rheumatoid arthritis also, people have been relieved of that. Some people have had remission of cancer in some patients, not all. And there is also asthma. People have gotten rid of asthma with these devices. So what is most important is in another research done in Max Planck Institute, they found that 6 weeks of love and kindness meditation resulted in the same increase of vagal tones in people as the devices that were implanted in patients. So without any invasive methods, by practicing the meditation, yoga, postures, and the pranayama, the deep breathing, you can, you can send your body into a state of healing, into a homeostatic state of being. So this is very encouraging for yoga practitioners when we are grateful. So the emotional culture happens in the practice of yoga. So when this emotional culture happens, we feel that gratefulness, the gratitude. Hey, I'm alive and I'm breathing. I'm able to, make the most of every moment that I am right now in. And the feeling of love and compassion. So when we feel these positive energies, we don't feel the hostility within us. We don't feel that anger, the resistance, the unacceptance of the situation that we are in right now, the COVID pandemic. We will not have that resistance within us. So these positive feelings, what does it do? It helps to remove the inflammations in the body by stimulating the ventral vagus nerves, by sending messages to the brain that all is well. Relax, all is well. So then the fourth one is the pranayama. So there are thousands of pranayama right now, and out of these thousands, 8 are very, very important. And of these 8, there's one pranayama that's the most important. And what is that? When you suspend breathing. So when you have an exhalation and the next inhalation, there is a gap between that represents the silence within, that represents the suspension of breathing. Now that is the transcendental. That gap that you have between exhalation and inhalation, that represents your source. You're connected with your source. Then you're joyful, you have equanimity of mind, you are in a state of consciousness. Okay, and prana connects that. In the pranayama, what you're doing is basically connecting your body with the mind. And wherever the prana goes, the mind goes. If your prana is fast, the mind is fast. If you slow down your prana, the mind slows down. If you bring a gap between the two, one inhalation and one exhalation, that represents silence. That silence is the one that is going to take you to your source, to that ever joyful state, ever healthy state. Okay, so during this time, the thoughts, what is happening to the thoughts are diffusing into silence, and therefore there are no agitations or disturbances or turbulences in the mind, and it promotes the good health, positive health. Now the next one is pratyahara. So pratyahara, not too many people talk about it. Pratyahara is a state of being that's not affected by the internal or the external environment. So you may have chaos going on around you, and you may have chaos going on inside of you. Are you able to bring your mind, pull your mind from all these chaos, disturbances from the outside and the inside world? Pull the sensory organs and perceptions away and then draw it towards your core self. Now that is transcendental. I mean, that is the pratyahara aspect of the yoga. That is the fifth. It comes after the pranayama. In this stage, mind could wander. So one needs to know it could wander, but we always make an effort to bring it back over and over again to the core self. That is the pratyahara. When you are able to do that, you are completely in alignment with yama, niyama, asana, pranayama. Okay. Next, when you are able to do that and keep the wandering mind, your sensory organs and the sensory perceptions away from all the distractions and disturbances, you're slowly having a concentration. Focused awareness. It's not concentration, because concentration gives you a headache. You don't want headache. So focused awareness, okay, in one channel, and that is called dharana. So here comes an object, of object of your observation. So concentration, the focus. And without any intervention of any thoughts, if you're able to maintain your observation of the object, that is dharana for you. Okay, that the focused attention on a object. It should be an object of divinity. So because it has to inculcate that divine feelings within you, divine emotions of love and compassion. So the object has to be divine. Then comes the dhyana. So dhyana is effortless meditation. So you have an object, you are the subject, you are watching that object, and the object, you merge with the object. The object reveals its truth about itself to you, and merging with that object, is called the dhyana. And the samadhi is where there is just total silence. You merge your egocentric self. There's no object and subject separate. It's all one, and you are merged with that universal consciousness, that is samadhi. And in a good yoga practice, you can touch all the limbs of the Ashtanga yoga. So that's why it's called the Ashtanga yoga, because there are 8 steps to it. You may say, oh, I have to be a good in yama, then I go to niyama, then I get promoted to asana. Then there's no such thing, because we are trying to reach our core self, expressing our natural behavior of love and compassion, forgiving, generosity, intuition, creativity, all of that comes in abundance when you're in your state of being. And so you don't need any prerequisite for that. You try today, and you might be surprised at your accomplishment, how much you're going to accomplish in one sitting. So now that we have understood all this, I can give a short guided meditation. It's so I won't take up more time. I'll just take up 10 minutes. I just want to cover what are the pranayamas that you can do, and the kriyas. I'll just introduce you to 2 kriyas that will help you to, let me push this thing away. So sit in a comfortable posture, sitting posture. Keep your back straight, and I'll just show you couple of kriyas. So keep your palm on your shoulders, and inhale, you have to shift to the left, and exhale to the right. Okay, inhale to the left, exhale to the right. So what you're doing is you're creating a rhythm with the body, rhythm with your breathing, because inhalation, exhalation, and your attention should be on the center of your inner space. So take a fingertip, put your fingertip here, press release. That's where you're going to focus on. And now you're going to bring rhythm into your body, breathing, and the mind with the kriya practice. So keep your back straight, keep your 2 palms here on your shoulder. Inhale, exhale. Okay, close your eyes, look at that center of your inner space. Rhythmic movement of your body synchronized with rhythmic movement of your breathing, which in turn is going to synchronize your mind. Give a focused attention to your mind. Listen to the breathing. When you listen, you will hear so hum, so hum, so hum. So with the inhalation, hum as you exhale. Engage your mind in the chanting of so hum, so hum. And you can stop. I'm just going to introduce you to these practices. You can practice for up to 2 minutes every day, and you can feel the changes within you. Due to the lack of time, I'm so sorry that I have to, do just for a few seconds. And the second kriya that I want to show you, these are very simple but very effective. Keep your back straight, very important. lift your shoulders up and take your shoulders back, but relax your shoulders. Keep your two palms on the knees. This is another kriya. So inhale, you're going to lift your shoulders up. Exhale, you're going to bring it down. Okay. Where should your gaze be? Close your eyes. Keep your gaze at the center of the forehead, the inner space called the Chidakasha. So keep it here. Inhale, exhale. Once again, rhythm. You're bringing about a rhythm in your entire psyche through a rhythmic movement of your body, synchronized with your breathing, rhythm in your breathing, synchronized with the mind. As it focuses on the breathing, it can chant so hum, so hum, so hum. Keep your gaze steady at the center of your inner space. Now relax. Keep your eyes focused again. Just with these two practices, practicing for at least 1 minute to 2 minutes, you will feel a suspension of breathing, or at least the slowness of your breathing process. And your mind calm down. So there is going to be what do you call, the mind slows down, the chattering mind, the internal dialogues that goes on and on and on, non-stop in the mind, it slows down. That's called the speed of the mind. So you're slowing down the speed of the body, slowing down the speed of the breathing, which is involuntary function, and slowing down the speed of the mind. These three things are happening. Please observe that. Now, the third practice that I'm going to work with you is the Kapalabhati. Very, very important breathing practice. Kapalabhati helps to remove the toxins from your body. Keep your back straight. As I mentioned, just by keeping your spine erect and deep breathing will trigger the ventral vagus nerve. So remember that. That sends a message to your entire body that all is well. So remember that. So now keep your two palms here on your stomach. For newcomers, inhale, expand, and then exhale, press the stomach. For those of you who know already, you do the, chin mudra. Keep your back straight, and then so your nabhi moves, your navel region moves, your diaphragm moves. The focus is on exhalation, inhalation is indirect, okay? Keep your gaze steady at the center of your inner space. Now you can stop the practice. After you stop the practice, keep your gaze centered. What's happening to your breathing rate? Has it slowed down? Have you created a gap between inhalation and exhalation? Do you feel the connection to your core consciousness? Mind is at rest, body is still, breathing is slow, or there is suspension of breathing. This is the homeostatic state I was talking about. This is the state in which everything is relaxed, every single cell is in deep rest, and you're healing. Your inflammatory response has calmed down. Your dorsal vagus nerves is calm. Your ventral vagus nerves is stimulated. Parasympathetic nervous system is stimulated. Now, this is where you want to be as long as you can. Okay, now Bhastrika breathing. Due to lack of time, I'm not going to have you do another Kapalabhati because I know Art of Living, you have another doctor coming over to give you a yoga practice. So we are going to do the Bhastrika, the second, another important practice. So make a fist, inhale, stretch your arms, your spine also stretches at the same time. Exhale, okay, through the nose. Close your eyes, gaze at the center, Hidakasha, awareness. Now you can start. Just with these few practices, you should feel the energy. You should feel the gap between two breaths, inhalation, exhalation. Relax your entire body and send a message to your inner self. All is well. Everything is good. I'm positive. I am strong. I'm filled with love and compassion. I feel gratitude within me. All right. Another important breathing is the alternate nostril breathing. So keep the first two fingers in between your eyebrows. Keep the ring finger on your left nostril, thumb on your right nostril. Now exhale, close your left nostril, open your right, exhale, inhale. Then you're going to close your right nostril, exhale, inhale from the left, and you're going to continue. Okay. So we'll just do 3 rounds maybe. So close your left nostril, open your right, exhale and inhale. Close your right, open your left, exhale, inhale, deep breathing. That is 1 round. Close your left nostril, open your right, exhale, inhale. Close your right, open your left, exhale, inhale. Close your left, open your right, exhale, inhale. Close your right, open your left, exhale, inhale. Now, stop the practice. After you stop the practice, what do? Close your eyes, keep your gaze steady at the center of your Chidakasha. Observe. Have you created a gap? Has your mind, the speed of your mind reduced? Has your breathing rate come down? Is your body relaxed? What does your environment look like, your internal and external? Can you remain undisturbed despite what is going on inside or outside? Now that is the skill we are getting. All right. So there is another one, the Brahmari breathing. So that's another important breathing practice. So here we are going to block the distractions coming from sound by blocking the ears with the thumb like this. We're going to block the distractions coming from the eyes, from the sight, by closing the eyes with the 3 fingers. Little finger goes over your nostril. Its job only is to, on exhalation, you have to slightly close it. On inhalation, you have to keep it open. All right. When you exhale, you have to make a humming sound. So we'll just do 3 times. Inhale. Now stop the practice. Keep your gaze centered. Brahmari breathing has the humming sound. That humming sound is very therapeutic to your brain cells as well as to the entire body, especially the ventral vagus nerves. The parasympathetic nerves get stimulated. It takes your body into a homeostatic state. Healing is triggered. There is calmness in your being. All with the breathing practices. Just observe. Now we're going to do the last one, which is the Shanmukhi Mudra. Now Shanmukhi Mudra blocks you from all the 7 gates in your facial region. Okay. So it's a very powerful practice. So any amount of stress you're going through, if you do Brahmari practice and the Shanmukhi practice, you will immediately feel that sense of relief, the relaxation floating throughout you. So closing your ears with the thumb just like this. Your eyes are closed with the first finger. So your first fingers meet at the bridge of your nose. The middle finger goes over the nostrils. The ring fingers goes above your upper lip. The little finger goes below your lower lip. So you're closing the 7 gates, 2 ears, 2 eyes, 2 nostrils, that makes it 6, and the mouth, which is the 7. So 7 gates closing, that's what it's called. Inhale, as you exhale, make a humming sound only 3 times. Inhale. Stop the practice. In the Shanmukhi Mudra, what you did is blocking all distractions from the sensory organs. And you focused on the humming within. And that humming sound drifted you into a state of deep rest, deep relaxation, in which the body can heal, in which every single cell can heal. Observe your body. Observe the environment you're in. Keep your spine erect, knowing that just by keeping your spine erect and deep breathing, you can reduce the inflammatory response in your body. Just by making humming sound, the Om chanting, you can reduce the inflammatory response in your body and take it into a state of homeostasis. Thank you all very much. So now I would like to, with everybody's permission, welcome Dr. Savita Karakol and Dr. Ajit Karakol. I would like to do a short introduction. Dr. Savita Karakol is a medical oncologist and hematologist. She runs her own practice with her husband, Dr. Ajit Karakol, who is also here with us. We are very fortunate to have them here. She did her fellowship in Boston University Medical Center, and she's affiliated with the Beaumont Hospital in Detroit. Dr. Ajit Karakol did his MBBS from Bangalore Medical College in Karnataka. He came to the United States about 25 years ago. He did genetic research in gene therapy. He has a number of publications to his credit. He has authored chapters in medical textbooks. He did general surgery training in Boston University. and vascular surgery training in Henry Ford Hospital, Detroit. He's currently practicing as a staff vascular surgeon in Henry Ford Hospital. Thank you, Dr. Savita and Dr. Ajit, for joining our celebration of yoga today. Now, to get the conversation started today, I would like to ask you a few questions in the field of cancer and heart disease and how yoga can help people with these conditions. So, a question to you, Dr. Savita. What is the role of meditation and yoga in the context of cancer and therapy for cancer?
Thank you, Sudha. Thank you for the relaxing hour. I have been your student, as you can remember, and I haven't been to your classes for a while, and this was pretty relaxing to me. Thank you so much. Yes, it's been challenging times over last year or two, and add to the challenge of pandemic, isolation, COVID-19 is the C word, the cancer word, which just makes it complex. Cancer diagnosis is much more challenging than many other medical problems. The anxiety associated with the disease, the fear of death, the fear of treatment, complications, just the whole fear of the cancer word, irrespective of whether it's a curable disease or not a curable disease, exists. And in this context, meditation and yoga has a huge role. And I can go on with this actually for hours about the benefits of it, and I'll try my best to cut it short. I guess one of the important aspects that I can stress on is the anxiety associated with the disease, which has a huge impact on the outcome. When you're very anxious, your thinking ability, either as a patient or as a spouse or as a family member, is very much gets foggy. It becomes very difficult to make decisions, and hence affects the treatment options, the speed in which we can do the treatment. And in this context, having meditation as a tool to help you will help you to calm your mind, to focus on the appropriate therapy, and to move on with life from various aspects. Reducing anxiety is a very important aspect in this situation. I've had patients, I don't want to elaborate too much on it, but I know if I have to give you an example, I had a patient with breast cancer who was diagnosed with a decently early stage disease, which could have been cured. However, because of that anxiety level, she refused to get treatment, and she was away from treatment for almost a year, and the disease spread quite a bit. And she later had to come back to me. At that point, we actually started her treatment, but during this whole thing, she went through ISKCON, and the meditation and yoga helped her tremendously. So that has a huge role in managing the disease. I do want to stress here that it's always confusing to see, can meditation and yoga be an alternative to the standard treatment that we offer for cancer? But I do want to specifically say that it is complementary, but not an alternative option. Combined mind and body treatment along with treatment for cancer, the standard of treatments we have will help us to achieve our goal of cure many times, or at least controlling the disease many other times too.
So we can say that it helps to improve the quality of the person with cancer with the treatment that with the chemo or the radiotherapy that they go through.
Yes, there is another aspect that I could touch on. One is obviously the anxiety part and emotional aspect of it, which can be dealt with. The second part I could touch upon is you brought up a very nice point. It is the quality of life. With cancer, cancer itself has a lot of effects on the body, like, for example, pain, nausea, vomiting, so many other things. And of course, the treatment just makes it even more complex because treatment arm also has many side effects, including nausea, vomiting, pain, diarrhea, constipation, many other side effects. And this can definitely be helped by yoga. One of the important aspects that I can talk about is pain. As like just like how you were explaining, it can be controlled. Pain can, I would say, be controlled through meditation and yoga. And if you can do that to a certain extent, then your dependence on pain medications would go down significantly. Again, if you take pain medications, that comes with a baggage of its own side effects. So avoiding use of further medications and controlling pain would be a very important aspect of improving quality of life. The same is true actually with nausea vomiting too. As you can see with different patients, there are different patients who react differently. I would think that it's part of it is also got to do with their emotional status, mental health, and those issues, and that can also be addressed. And many other symptoms can be controlled through meditation and yoga.
Yeah. Thank you, Dr. Savita. I have one more question for you. What's the role of these in palliative care and the incurable cancer?
That's another great question too. Yes. Fortunately, there's one message that I want to get through during this conversation, even though it doesn't exactly relate to this. Is in oncology world, fortunately, over last decade, we have made significant improvements, mind-boggling improvements. The amount of cancers that we cure today is tremendously better than what it was 5 years back or 10 years back. Every day we are having new drugs that are come out. Like last year, we had like 17 drugs approved in oncology. Day by day, we are getting better and better. The number of patients whom we cannot cure or eventually have to give up on treatment and get into palliative care are getting lesser and lesser. That's a good news. However, we still have that handful of patients, or quite a bit of patients, I would have to say, today, in whom we help them through the process of death, through the process of getting them through the disease. And in this context, I think, again, meditation and yoga has a huge impact. We all have an expiration date. We are all going to go one day. And I guess through the way you described it with meditation, focusing it on your inner self and consoling yourself and passing through that process of death and managing your life, your loved ones' life, and your overall life, I guess this would have a huge impact. And I do have to say quite a bit of my patients do benefit from these therapies when they're going through the process of death and palliative care.
So one of the challenges, Dr. Savita, is the acceptance of the disease. And I think the yoga and meditation would play an important role in having the patient accept, the cancer that they have. And once they are able to accept, I think they will be more open to, improving the quality of life through the meditation process.
That is true. That is true. And it definitely helps in that context.
Yeah. Thank you, Dr. Savita. That was very informative. Now, I'm going to open it up to Dr. Ajit Karakol. Dr. Ajit, can you give us a little more information on the heart disease? There seems to be a lot of confusion about the definition of it. So would you be able to please let us know? I think you're on mute, Dr. Ajit.
Namaskar. Can you hear me now?
Yes, we can.
Yeah. It was a fascinating talk, Sudha. And as we all of us know, yoga is a cultural heritage of India. But now we are discovering that we have always known in our hearts that yoga has significant medical benefits. But now, through research, the entire world, including India and the Western world, is now accepting that there is significant health benefits from yoga. Now, when we come to heart disease is one of the leading causes of mortality in the world. When we say heart disease, we typically refer to what is called coronary artery disease. What that is the blood vessels that supply the heart with energy to work. Heart is a pump, And when heart works, it pumps blood, and the energy required to do its work is supplied by the blood vessels with glucose and oxygen. If these blood vessels get clogged up, then you get a heart attack. Then you survive a heart attack, your heart becomes weak, the pump becomes weak, part of the heart muscle is dead. That is heart failure, that is called heart failure. So when we refer to heart disease, the major chunk of the disease that we are referring to is what is called the coronary artery disease, which is cholesterol plaque deposition in the blood vessels that bring blood to the heart. That is what we mean when we mostly, there are other kinds of heart diseases, but most of the heart disease and most of the mortality is caused by what we call as coronary artery disease, where there is cholesterol plaque deposition in the blood vessels. And when people have such problems and they have heart attacks from it, and then they go doctors, you have, all of you have heard how stents are put in the heart, or a balloon is used to open up the blockages in the blood vessels, or a bypass surgery is done. So when we say heart disease, we are referring to this uh, aspect of heart disease mainly.
Okay, thank you, Dr. Ajit. That was pretty informative. Now I have another question. What are the factors that lead to heart diseases?
See, some of the, as I said, if the blood vessels get blocked by cholesterol plaque, then the heart muscle cannot get blood. So one of the obvious things that is there is the cholesterol levels and the kind of food we eat, the cholesterol levels in the blood, and the cholesterol levels, if they are high, then cholesterol plaque deposits in the blood vessels. So that causes blockages in the blood vessels.
Okay.
Secondarily, if you see, if you have high blood pressure for a long time in life, even if it is well controlled, it causes slight damage over a period of time to the inner lining of the blood vessels and encourages more cholesterol plaque to deposit. If you have a high stress life, that also secretes certain hormones and factors that can increase the chances of having coronary artery disease. Then if people smoke, smoking can also make more cholesterol plaque deposit in blood vessels, causing one to have a higher chance of having a heart attack. So the factors that contribute are multitude. We see it ubiquitously amongst us, be it stress, high blood pressure, high cholesterol, or smoking. So these are the usual factors that lead to increased incidence of heart disease.
Okay, thank you, Dr. Ajit. How does yoga help with respect to heart disease and cardiovascular health? You yourself are a yoga practitioner too, so can you throw some light on that aspect?
See, if we, the answer to the question lies in your second question, the factors that lead to heart disease. Now, if we are able to control the factors that lead to heart disease, then you are probably able to make an impact on the incidence of heart disease and how many people get heart disease, or what are the chances of you having heart disease in life. So, if you look at the factors, research has been done in a number of institutes. Actually, there are a number of papers on the relationship between yoga and heart disease in the Western world itself. And a lot of what we call as randomized controlled trials have been done, wherein you take a number of people who do not do yoga and compare them to another set of people who do yoga, and compare the incidence of heart disease in them. And such multiple randomized controlled trials have shown beneficial effects of yoga on heart disease. There is some certain uh, limitations of these studies, and more studies are required to prove it. But some limitations are, when you compare a number of people that are doing yoga versus those who are not doing yoga, the people who are doing yoga may not be doing it in a standardized fashion. So it becomes, comparison becomes a little difficult.
Yes.
Also, there are other design flaws in studies, but having accounted for them, they have found out, number one thing that they have found out is yoga reduces your blood pressure. So, as I said, increased blood pressure through life leads to heart disease. You can see how reduction in blood pressure leads to reduction in the stress on the heart. Secondly, they have found out that the reduction in the stress as a whole, like emotional stress that people have in life, calming of your mind, also has a significant impact on stress reduction on the heart. As we earlier said, all of us are type A personalities and we have a high amount of stress. Reducing stress also reduces heart disease.
Yeah.
Thirdly, people have found that it is not clearly known how yoga does this, but the cholesterol profile of people who do yoga is better than that of people who do not do yoga, such as, the bad kind of cholesterol is LDL cholesterol. They have found a reduction in the bad kind of cholesterol and an increase in the good kind of cholesterol called HDL. So
Mhm.
it is not know how exactly yoga causes this biometabolic changes in the body is not well known, but it has been documented in studies.
Okay.
And people have also seen that people who practice yoga, when doctors say tell patients to quit smoking, people who practice yoga have a higher likelihood of quitting smoking. So yoga attacks the causative factors of heart disease in a multi-pronged way. It reduces blood pressure, it reduces the cholesterol level, it reduces the stress level, so on and so forth.
Mhm.
So there is a multiple effects of yoga. More research is needed to confirm these effects, but it is well documented in multiple trials that
Mhm.
yoga does help in reducing the incidence of heart disease.
Thank you very much, Dr. Ajit. That was really, really, informative to us. And now we have a better understanding of what heart disease is and what factors lead to heart disease and how yoga can help. Thank you so much. And thank you so much, Dr. Savita, as well. I would now like to open it up to the audience. If there are any questions for us, please feel free to ask us. Dr. Nethra, do you want to take over?
Yeah.
Yeah,
Thank
thank you very much, all the three speakers. It was an excellent day. Really, I feel mindfulness after listening to all the three eminent speakers. From the day one, I practice yoga quite a bit, but somewhere whenever I see YouTube or sometimes I feel there are certain things that these postures shouldn't be practiced by people who have high blood pressure or people who have already some heart problems. Uh, is there anything like that, that some particular breathing exercises or particular postures should not be practiced by people with high blood pressure, ma'am?
Yes. So um, the Kapalabhati breathing is something that people with high blood pressure should not practice. However, if the blood pressure is under control, they are allowed to practice the Kapalabhati breathing. Um, Instead of the ventilation breathing that is involved in the Kapalabhati, they can do deep breathing. So, as a part of the Kapalabhati breathing. Another one is the Bhastrika. Bhastrika is also quite, it involves hyperventilation and should not be practiced by people with the high BP or with the heart issues. As far as the postures are concerned, the Pada Hastasana is something that people have to be careful who have blood pressure. And especially if they feel dizzy doing any of the postures, I think they have to right away stop it and take a little bit of a rest and not try those postures, when they practice.
Okay. Okay. Even Parvatasana found to be little risky for the
Yeah,
people who has got vertigo or
yeah,
who has got
yeah, yeah.
certain.
Right, right. Ardha Chakrasana is not something that people with vertigo can do. Whereas I used to have vertigo about 5 or 6 years ago. I did do the postures through all of my recovery process. During all of my recovery process, it was not very debilitating to me, but I have heard other students, who have stopped doing the yoga practices during the time they were recovering from vertigo. So it's good for them to keep their eyes open, when they do the Ardha Chakrasana and then the Ustrasana, and like you said, even the mountain pose, they have to keep the eyes open. And if they are having any of those dizziness feeling, they should stop right away. And triangle pose was something that I was not able to do, so I chose not to do until I fully recovered from vertigo. So it depends from person to person. If you are not comfortable moving your head away from the normal position, then please don't do any of the one that causes dizziness.
Thank you. Uh, as coming to the current pandemic situation, more than earlier, we used to be scared to even to just get tested for cancer or any of these diseases. Now it has become nothing. The scariness has gone several fold in terms of COVID-19, including my family members and many people. I observed the deaths are more of due to the stress and the tension what it caused, that I'm also a person who got it, whether I recover or not. This kind of situations made them not to respond to any of the treatments.
Yes.
And most of the treatments which are responding, I'm really sorry, and my complete submission to all the doctors world over. But many of them who are responding and coming out is due to their positivity. Maybe it is the placebo effect which is causing them to recover faster from COVID-19 rather than the actual medication itself. That so many of the places, why can't even either in Henry Ford or in our own hospitals, doctors taking little time, or they are very busy. I can understand that they are struggling and they are at the cost of their life, they are doing lots. But why can't we have 1 or 2 minute sessions of this breathing or stress management programs included in our entire protocol of the treatment of COVID-19 pandemic?
I think that would be a question for Dr. Savita and Dr. Ajit. You want to comment on that?
I can say a few things. Yes, it is called as integrative medicine in hospitals in US. I'm not much aware of what's happening in India because I think I haven't practiced there for 20, 25 years now. But here there is what is a department called integrative medicine, but it is pretty primitive, I have to say, and it has not been yet well integrated into the actual patient care. Probably more, we may need more stronger data. It could definitely be included. It could something that we need to bring it up down the line and see. But it is in its rudimentary stages, I have to say.
To add to that, what I will say is, like complementary or alternative lifestyle therapies are definitely encouraged by the modern medical facilities. There are in many hospitals there are days in which a yoga teacher is called and yoga is taught to people, and it is being made popularized. I would echo Dr. Savita's thoughts too. I think more time and more research will be required before these things become like a part of policies, wherein hospital administration start promoting it. I think, unfortunately, at this point in time, I have to tell you that we will have to wait for that day. It's not, we are not there yet. Just to change the subject a little bit, as I was reading literature on yoga, I did notice that with respect to asanas, uh, certain conditions of spine, such as disc disease or spondylosis of spine. In those situations, medical research suggests that any asanas or poses that puts a significant stress on the spine should be avoided. Yeah, also in patients with a condition called osteoporosis, where the calcium level in the bones is less, in such people also, uh, postures or asanas that impose a lot of strain on the spine should be avoided. This is something that I came across as I was as an incidental thing as I was reading about the effects of yoga on cardiovascular health. So I just
Yeah.
wanted to add that.
Yeah.
One more thing I wanted to add on quickly is that there is a book called Up to Date. It's actually an internet book where it gives you the most updated information on medicine. And all as physicians, most of the times we refer to it. If I need to know something about a medical condition, I go on uptodate.com. That is kind of the standard book. And I was surprised to see when I was preparing for this talk that there are multiple chapters on yoga and meditation and associated with various diseases. That is definitely a significant improvement.
Yeah, yeah, you're right, Dr. Savita. There are, targeted postures for various ailments, and trained yoga teacher can, help guide the person with the right postures to do. And in Bangalore, especially, we have S Vyasa, led by Dr.
No.
Nagendra and Dr. Nagratna Didi, and in fact they were my teachers too. So they have run a clinic as well in Chamarajpete, where one can go, and for a specific ailment they will prescribe the kind of asanas they can do. Based on the medication that they are taking and based on the symptoms that they have, the prescription of yoga postures will be different.
Yes, Dr. Savita and Dr. Ajit and Dr. Sudha, it was really amazing. What I feel is, it is my personal opinion, nutrition and dietitians were not a part of our system earlier, good olden days. Now it has become every hospital, even however small it is, nutrition and dietitian has become a part of this. In a similar way, stress management, if not big asanas and postures, a small stress management thing anybody can practice anytime, even while going in a car or while sitting or early in the morning after getting up. Just 2 minutes doing deep breathing exercises and drummery will not stop anybody. At least on this International Yoga Day, all of us should take a oath stating that as soon as I get up early in the morning, at least few practices which can make my mind calm and peaceful, who can fight with the daily, not only daily course. Actually, we are fighting bigger issues than pandemic, but the pandemic has taken over in our regular lives, in student life, in all everybody's life. Really, it was a wonderful and great session. I would have loved to have much more time with all three of you. Thanks a lot. Thank you very much. Over
Thank
to
you.
Nethra. If there are any questions in the chat box or anything, few questions you can take. I think it is already 8 o'clock. You can just ask the questions or open their uh, chat box or give them a chance to ask questions. Open for discussion.
Yes, ma'am. Thank you, ma'am. There is one question. What are the types of yoga practiced in daily life during diabetes? So there's a question from one student.
So for diabetes, your the child pose is good. The yoga mudra breathing is very good. And any posture where you bend and put some pressure on your stomach is a good one. The Pada Hastasana is good, and Paschimottanasana is good. Triangle pose is good. Ultimately, I think somebody said, Padma Shri, madam, I think, who said, any posture that you do, if you do connecting your body, mind, and the breathing, the healing kicks in. So in one of the talks, Dr. Deepak Chopra said, there are some 30 basic postures, very basic postures. If one does that, which doesn't take more than half an hour, by the way, in a day, it can stimulate the nerves that are connecting to each of the visceral organs, and it can heal them. So, I mean, I hope that answers your question. If you're not able to do all of the postures that I prescribe, if you can do just the basic postures, but make sure you're connecting, you're focusing on your body, on focusing on your breathing, and be in the moment as you do the posture, you will reap the benefit of the postures.
Ma'am, there is one more question. So the student has asked, can you mention the book name of yoga therapy, like updated version? So this is a question from a student.
Oh, okay. You can refer to the Positive Health written by Dr. Nagendra and Dr. Nagratna Didi. I will send it to Indu, and and she will. I hope she will be able to
Yes, sure.
share
Yes.
that with the rest of the. Okay, thank you.
There was a question in one of the chat boxes. I'll take that question. Somebody has asked here how long you should do yoga to see benefits. Some of the randomized controlled trials have shown that if yoga is done for about 30 to 45 minutes per day, about 3 to 5 sessions in a week, up to 3 to 5 months. That is the research has shown. I'm just putting out those numbers. There may be some difference of opinion on those, but that is what is said, that up to 3 to 5 months, you will have significant changes in the biometabolic markers of heart disease. So I hope that answers your question in a general way, that if you practice yoga for 3 to 5 days, 30 to 45 minutes, for 3 to 5 months, then the body will start changing inside in a positive way.
Thank you, sir.
Sure.
So there was.
Ma'am, there is a question. What are the yoga postures to reduce anxiety?
Yeah, so the anxiety, again, the Ardha Chakrasana, you need to let the blood flow to different parts of your brain. That's the main focus here. So Ardha Chakrasana, Pada Hastasana, when you do Ardha Chakrasana, chant Ah. As I mentioned, the chanting has the therapeutic effect on the brain cells. So Ah chanting, when you bend down, you do the Oo chanting, and then, triangular pose also has a very, very important, it plays a very important role in anxiety and depression. So you're bending to the right and sending the blood to the side of the brain and the left side of the brain. That is a good one to do. And sitting posture, you can do Paschimottanasana is a good one, Baddha Konasana, and I'm not able to, but I can send you the prescription for the anxiety and depression again to Indu, and she can share with you all. The Brahmari breathing helps a great deal. Nadanusandhana breathing helps a great deal, and the Titali Karana Pada Pranayama helps a great deal with the depression, anxiety and depression. Basically, what you're looking at is the most important thing in all of the practices is to be able to focus on what you're doing. So whether it is the Brahmari breathing or the Nadanusandhana, just focus on your breath, focus on your body, what change is happening on the body, and be in the moment. The effect happens right away.
Thank you so much, ma'am.
Mhm.
Same question like regarding asthma, PCOD, and bent back neck. So, what are the like yoga postures they want to know with all different conditions?
Yeah. So for the back pain, there's nothing like yoga. I think you may go to the physical therapist, you may go to any kind of doctors, but the best medicine that a back pain has is yoga posture. So Setu Bandhasana is a very good posture to practice for back pain. And mountain pose is another one. Ardha Chakrasana, don't bend too much, just a little bit of a bend. It helps with that arch, to alleviate some light back pain. But the Setu Bandhasana, the fish pose is another one that you can do. And, there's another, I don't remember the name of it, but you take both your knees to the side, and then you stretch the arms on the side and look in the opposite direction. I'll send you the names of that with the pictures to Indu. That is a very good one where you're twisting the entire trunk of your body to the right side and turning your head to the other side. That is an excellent one. And you can do one leg at a time too. Lift the left leg up and turn it to the twist it to the right side, and you twist your head to the left to the other side. So those are all the practices that really, really helps with the postures. And I'll send you the pictures with the instruction to Indu, and she can share that with the students.
Dr. Sudipta Mohanty, you raised your hand. You can ask your question, please.
Yeah, first of all, thank you all the speakers. You really made our day. I have a question to Sudha, madam. You told about different pranayamas like Vasrika or Kapalbharati. How many rounds actually we need to make minimum so that we'll get the benefit? Or
benefit of yeah. So I personally do the Kapalabhati 5 times. And I don't exceed 60 strokes per minute. So each round should not exceed 60. That was the instruction given to us by Dr. Nagaratna Didi. So that's what we follow. And then Bhastrika, I do 5 times. And each round is about 25 to 30 times. Then the alternate nostril breathing, you can do about 10 times. Brahmari breathing 5 times. And the Shanmukhi Mudra 5 times. So all of this should not, I usually do the Ujjayi breathing. Because of lack of time, I couldn't, do the Ujjayi breathing with you. But if you do that about 10 times. So this should not take more than 15 minutes, and that will help you really to calm down and feel that relaxation and the presence of being right away.
Okay. Thank you very much.
You're welcome.
I have a request on behalf of Padma Shri Group of Institutions, Sudha. If you can send these anxiety releasing postures, a small recording, we can circulate to
Absolutely.
all our students so that they can keep that recording and practice every day. Because most of the students come out with anxiety rather than any other issues.
Yeah.
Because in that age, that is the most prominent one.
Right.
That is why there are many questions on anxiety.
Yeah, so I will send a 1-hour recording for anxiety and depression. In fact, that is the cause for the back pain and the neck pain that they are talking about, spondylitis. All the anxiety and the depression is the one that causes that heightened hypersensitivity in the body, the fight or flight response or the freeze response, and causes inflammation in the body. So, I will definitely, it'll be an honor for me to do a recording and send it to you.
Thank you. Thanks a lot.
Yeah.
It is already 8:10.
There is a
feedback
form students can fill, and the session 2 also it will be post, and they have to fill it again.
Okay. Thank you. Thanks a lot. Over to Nethra. You can conclude the session with the permission of the panel.
Yes, ma'am. Thank you so much. Again, I'm going to tell your feedback is valuable. Please give your feedback. The link is already been posted in chat box. Now it's time to conclude and thank one and all, without whom this event would not have been successful. On behalf of Padma Shri Institute of Management and Science, I thank Dr. Ashwath Narayan, Honorable DCM, Minister of Higher Education, IT and BT, Science and Technology, Skill Development, Entrepreneurship and Livelihood, Government of Karnataka, Shri Nayanappa Sir, Managing Trustee, Padma Shri Group of Institutions, Shri Satish Sir, Chairman, Padma Shri Group of Institutions, Professor Shenoy Sir, Director, Padma Institutions, our beloved Principal Ma'am, Dr. Anuradha M., Padma Shri Institute of Management and Sciences, our eminent guest speaker, Ms. Sudha Rao. Literally, it was wonderful talk from her. She also demoed simple yoga practices, which help us to remain undisturbed in spite of what going on in our in. Thank you, ma'am. Dr. Savita Kadkol and Dr. Ajit Kadkol, who also like mentioned about the yoga as a complementary to improvise the health conditions. Thanks a lot, both of you. Event organizing team, Dr. Indu ma'am, Mrs. Subbalakshmi, dear colleagues, ladies and gentlemen, beloved students, thank you one and all. Please join the session 2 at 9 a.m. where Dr. Veda Murtachar, yoga teacher, Art of Living, Bangalore, would be demoing the practices. Thank you again. See you all at 9 a.m. Thank you.
Thank you.
Thank you.